Good day, everyone. We are the Group 3 and we will be presenting to you the rehabilitational or the functional model of disability. So before we delve into our topic, I would first like to share to you the terms that we will be encountering as we go along the way. So we have models of disability. So what are models of disability? Those are conceptual tools used for defining impairment and are used as guides in order for the government or the society to assess what are the negative factors that need to be eliminated in order for impaired people to have a better life. Next, we have the term disability. So similar to the medical model, the functional or rehabilitational model sees disability as a defect or something that needs to be fixed right away in order for the impaired people to function properly once more in the society. Lastly, we have the term rehabilitation. So when you hear the word rehabilitation, what comes to mind is that rehabilitation is a process of restoring physical or mental abilities that has been lost due to a serious injury or from a recent accident. So in this functional or rehabilitational model of disability, a person who has an impairment is considered as someone who is defective and a failure. Because of that, it aims to get rid of that person's disability or impairment in order for them to be functional once more. And I would also like to add that the difference between the medical and the rehabilitation model is that the impairment that one has in the medical model is genetic or something that has been with them ever since they were born. And the impairment or disability that one has in the rehabilitational model is something that has been acquired recently or due to an accident.
Now let's discuss the types of rehabilitation. The first type is medical rehabilitation. So medical rehabilitation offers services designed to reduce the disability and dependence of a disabled person. So these services can help the disabled person to be better in his daily physical or mental activities. So it can increase potential capabilities, correction of deformities, and restoration of function. The next rehabilitation is the social rehabilitation. It aims of getting people back to the society. This will help and develop a person's coping skills with everyday life, improve their possibilities for social participation, support their studies, and restoration of work ability on some level. So it implies on their social life. It can help them restore their relationship with their family, interact with other people, or build relationships with them. The next type of rehabilitation is the psychological rehabilitation. So it focuses on removing any phobias, anxieties, or self-doubt arising out of the disability. So this rehabilitation can help the disabled person to gain confidence. So this work normally accomplished by psychologists or counselors. We all know that if you are a disabled person, it is very difficult for you to find a job. But this last type of rehabilitation can help you not to worry. So the last type of rehabilitation is the vocational rehabilitation. So the vocational rehabilitation, the purpose of this one is to aid the disabled person in receiving trainings for new occupations, locating jobs, retaining jobs, and building permanent careers. So in other words, it helps the disabled person who find it difficult to get a job or to get an employment. So those are the 4 types of rehabilitation: medical rehabilitation, social rehabilitation, psychological rehabilitation, and the last one is the vocational rehabilitation.
So now let's move on to the principles of rehabilitation. So the first principle of rehabilitation is that it should begin during the first initial contact with the patient. So for example, that patient has a psychological disorder. he or she should be assisted immediately by the medical professionals so that that person will undergo into therapy and recover as soon as possible. So the second principle of rehabilitation is that the emphasis or the importance of it is to restore the patient into, in independence or pre-illness or pre-injuries level of function as soon as possible. And the third principle of rehabilitation is that he must be an active participant. Of course, it is really important if the patient is very participative in every therapy session so that he or she can recover as soon as possible. Last but not the least, the fourth principle. So it motivates and helps the patient to attain social independence. So of course, by living these principles, the patient will surely recover and be well. And now let's move on to the aims, the intention, or the purpose of rehabilitation model. So the first one, like what I've said earlier in the principles, so it is to restore or to bring back what has been lost or damaged. And then the second is to compensate or to reduce the damage caused by any injuries or illness. And the third is to prevent or to slow the deterioration in functioning, whether in sensory, intellectual, mental, cognitive, or social. That this model or the rehabilitation model help the individual to reach their optimal levels.
So next would be the generalization or critique. This approach often fails to consider the reality of the permanent disability. Why? Because this model shares a lot of characteristics of the medical model. It has been rejected by many people who have disability. In the past and even today, it is a common way on how people think about disability. The problem contained is the individual who have a disability instead of the problem of the environment around them. A disability solution can be done by medical professionals with things like prosthetics, surgeries, medications, and other services. And another way why rehabilitative model and medical model is related because in the belief that if the person make an effort or work with rehabilitative services, they can overcome their disability. This model is criticized by many people who have disabilities, disability study researchers and advocates because of its narrow view that people lead despite and because of their disability. And also many people think that their disability is not something that need to be cured but an integral part of their identity. This is also restricts the disabled person's opportunities to solve problems, make choices, and develop their potentials. And lastly, I personally agree that people with disabilities need medical intervention, but it is naive and simplistic that medical system is the appropriate focus of the disability-related policy matters because many disabilities and chronic medical conditions will never be cured. And that's all for our report of the functional or rehabilitation model.
So now that we are at the end of our report, so we have one quote for you to ponder. Recovery is not for people
who need it. It's for
people who want it.